phone.
Hello, Mr. Clark. My name is Brittany, and I'm here to do your physical exam. How are you doing?
Doing good. How you, man?
I'm doing good. So I'm going to go ahead and wash my hands and make sure my hands are nice and clean. And we're going to assess your level of consciousness. Can you tell me your date of birth?
12364.
And where are you?
At the office.
Okay. All right. So I'm looking at his skin. I don't see any bruises, no rashes, no cuts or scrapes anywhere on his skin. And then I'm going to inspect his head. And he actually does not have any hair, so I won't have to look at the distribution of the hair because he would be classified as bald. We're going to palpate the TMJ and jaw movement. So he's going to open his mouth, close. Excellent. And then we're going to do a facial sensation, so you can tell me if this is soft, dull, or sharp.
So.
And I would do it on the opposite side as well. And we're going to test the facial movement. So can you smile, raise your eyebrows, frown, puff out your cheeks? Okay. And all of his movements are intact. And then we're going to check the visual acuity. So what we're going to do is, at this point, we're going to see if you can say those letters. Cover your right eye first.
B-U-S.
And he's going to check the left. Cover your left.
B-U-S.
And then just look at it and say the letters.
B-U-S.
And his visual acuity is 20/20. He gets all his points for that one. And then we're going to inspect the eyebrows and the eyelids. His eyebrows have hair that is easily or evenly distributed. And then we're going to palpate and inspect the lacrimal apparatus. And we're just going to feel right in there. And then we are going to inspect the conjunctiva, the sclera, and the pupils. His conjunctiva and sclera is white. Pupils look even and dilated. Not dilated. Not yet, at least. And then we're going to, let's see. Okay, so follow this with your eyes, not moving your head. Okay, perfect. All right. And then we're going to perform the fundoscopic exam. And with this, we don't actually have a fundoscope, so we're going to just pretend. And with this, we're going to, well, let's see. We have a lot of kitchen tools that we're going to be using for this part. Okay, so I'm going to look. Okay. And then we're going to test the pupillary reaction, and I don't actually have a pen light, but I do have a little flashlight that we're going to try and do it with. All right, so you look straight at me. Okay, straight at me. Okay. And that one's off. Okay. And then we are going to, let's see. Okay. And we're going to check the auditory acuity. So I'm going to whisper a word in your ear and you tell me what I say.
Red.
Okay. And we would do it bilaterally on both sides. And we're going to inspect the external and internal ear. So we're going to we would do right side, then left side next. And ears look good, and the inside looks good as well. And then we are going to test the olfactory sensation. So we have a candle here, and if you can tell me what it smells like.
Coconut.
Okay. And his olfactory sensation is intact. And then we're going to perform the appropriate nose exam. So we're going to be looking up his nose, but we're not actually going to do it. We're just going to pretend. So if you can tilt your head back. And we're going to look at both nostrils and the septum's not deviated. Okay. So now we're going to inspect and palpate the lips and gingiva. So we're not actually going to do it, but I'm verbalizing it, and his lips look even and no deformity. He just moved his lips a little bit. And then can you show me your teeth? Okay, his gums look good. And then his teeth look good as well. We're going to assess his swallowing and the rise of palate and the gag reflex. So can you open your mouth? And I would have a light and I would look inside. Look at the palate. Can you swallow? Can you say ah? And I would stick in a tongue depressor to check his gag reflex. Okay, and then at the same time while I was doing that, inspecting his tongue, making sure it was symmetric and no abnormalities found on that. And then we also inspected the soft and hard palate and the uvula while we were inspecting inside of the mouth. Okay, so now we're going to inspect and palpate the position of the trachea. So I'm going to stand behind you and just feel the trachea. Okay. No abnormalities felt with the trachea. And then we're going to palpate the isthmus and bilateral lobes of the thyroid from standing behind as well. And no abnormalities felt. Okay, and then, let's see, we're coming on down to the lymph nodes. We would also perform an appropriate face, neck, and supraclavicular lymph node exam as well. And then we're going to inspect the chest and assess for respiratory effort. So I'm looking at his chest. His chest looks good. No abnormalities, no scars as indicated from a heart surgery or any kind of surgery like that. We're inspecting. His rise looks even and unlabored. And his respiratory effort is good as well. I'm inspecting the lips for cyanosis and the nail beds. Can I see your fingertips? No cyanosis noted. Okay, and let's see. And we're going to auscultate the chest with alternating sides. So this is where I'm going to take my stethoscope and listen. And we would do that on both sides. Okay, and we're going to inspect for apical impulse. Impulsation lifts and heaves while the patient is sitting. He's sitting. I'm not seeing anything, so which is a good sign. And then we're also going to check for jugular venous pulsation and suspension, but he would be laid back in a 30-degree angle at this point. But since we're not able to do that, we're just going to pretend. So I would look, and I don't see anything as well. All right, so we're going to palpate for heaves and lifts while he is also at the 30-degree angle, and we would just be palpating. Okay. And then we're going to palpate for thrills using the ball of our hands. And then we are going to palpate the second intercostal space at the right and left sternal border while he is also in the 30-degree angle. And we'll also palpate the third intercostal space at the left sternal border for the Erb's point and tricuspid area. We'll also do fourth and fifth while he's in the 30-degree angle and then do the point of maximum impulse. And we'll do that on both sides. All right, so we're going to auscultate the pericardium at 6 relevant points using the diaphragm and the bell. Okay. No abnormalities occurred with that. And we did that with the diaphragm and the bell. And we're going to place the patient in the lateral decubitus position, but since we're not able to do that, we'll just verbalize that for right now. And we'll auscultate the tricuspid and mitral areas with the bell. And then we'll have the patient sit. Can you lean forward for me? And exhale, and while holding his breath out, we'll auscultate at the apex using the diaphragm. And just lean forward and exhale. Okay, lean back. All right, thank you. All right, so we're also going to auscultate bilaterally for bruise in the carotid, renal, iliac, and femoral arteries. And then we're also auscultate in the abdominal aortic artery as well. We'll just do one. Okay. And we would do all of the ones that I just stated in order. So now we are going to palpate the carotid, radial, and femoral arteries bilaterally, and then we'll palpate the radial arteries bilaterally and the femoral arteries bilateral as well. So I'm just going to do these first. And then we would do the others if the patient was in a gown and draped, and we were able to do that with a table. Okay, and then we would also palpate for abdominal aortic aneurysm, note for any peripheral edema or peripheral hair growth, and the hair would be evenly distributed. No peripheral edema. We would check the ankles for peripheral edema as well. And then the lymph nodes, we would check the inguinal, horizontal, and vertical axillary and epitracheal lymph nodes. Let's see. And then the abdominal examination, I would have a patient lay back, and I would expect the abdomen to note any distension or hard lumps or anything. But first we would inspect and then auscultate. So I would note that the patient does have active bowel sounds in all 4 quadrants. And let's see. Then we would do percussion and palpation. That's where we would notice if there were any hard lumps or any liver, the size of the liver, as well as if we could feel the spleen. And then we would go ahead and move down to the rectal, urogenital, and pelvic exam, but we're not going to be doing that for this purpose. All right, and we're going to assess the gross and overall neurologic status of the patient. He seems to be awake, alert, and oriented, and can answer questions appropriately. We're going to expect the upper and lower extremities for bulk and looking atrophy. Can you hold your arms out for me? And we're looking, no bulking, no atrophy. And can you keep your hand up while I push down? All right, and he seems to have good muscle tone and good strength of the upper and lower extremities. And we would do the same thing for the lower. Okay, and then we would test the deep tendon, biceps, and triceps reflexes. And if I had like a little, well, you can use this little apparatus and test. Hold your arm to the side. Move it. Okay. All right, and his reflexes are intact, and we would do that bilaterally. All right, so then we are going to move on down to the plan. We would also do the plantar response as far as his feet go. And then we are going to do the finger movements. Can you do your right finger to your nose, left finger to your nose? Okay. And can you touch my finger? And the other one? Okay. All right. And then I'm going to have to get you to stand up and walk. Just walk around and come back. Okay. And then can you walk heel to toe? Heel to toe. Okay. And he's trying to walk heel to toe. Thank you, Mr. Clark. Okay. And then his gait was fine. He doesn't need a cane or anything to help him with walking. And we are going to test, let's see, light touch and pain and temperature for his toes. Let me see your toes. You don't have to take them off. You tell me if this is soft or dull or sharp. Okay. All right. And we're coming on down, and we're going to inspect and palpate his C-spine. So I'm going to look at your spine back here. He would have a gown on. I would open his gown to the back to allow me to see it. I don't see any rashes or bruises or any abnormalities on the skin. His spine looks even. His head looks even with the sacrum. And we're going to evaluate forward flexion and the rotation and lateral bending. So can you bring your chin to your chest? Bring your chin back like that. Look to the left and right. And then put your ear to your shoulder and the other shoulder. Okay. And let's see. And we would check the flexion and extension and inspect and palpate the thoracic and lumbar spine. So let's see with that. We are going to have we would have him laying down on the table, and we would check for moving his knee to his chest, both knees bilaterally, and then we would do some rotation with both of those as well. Okay. And then we're moving on down, inspecting and palpating the shoulders. Shoulders look good. We would check bilaterally for that, inspect and palpating. And then we would assess the mobility. Can you hold your arms up? Can you pull them down? Okay. And then do like this, and then rotate. Okay. And then we would move on down to the wrist, hand, and fingers, and we would just do one. And we would do this bilaterally though. So can you do this? move it, circle it, and his wrist seemed to be working just fine with no clicks or anything heard or felt. And we would do that bilaterally as well. And then we're going to inspect and palpate the hip joint bilaterally and assess the mobility of the hip. And then we are going to inspect and palpate the knees and the mobility of the knees. And he has had knee surgery. So which one did you have knee surgery on?
The right
This
knee.
one. So this one's probably going to be a little bit more mobile than the other. So can you extend it out, flex it back down? And that's as far as we're going to go with that one. But we would do more if needed. And then we're going to inspect and palpate the ankles, feet, and toes. And his ankles look good. We're inspecting, we're palpating. And can you do some little movements for me? In, out, flex, extend. There you go. And that is going to conclude our exam. Do you have any questions?
No, ma'am.
All right. Well, thank you, Mr. Clark.